Hello everyone, this is Dr. Naina. I want to welcome you to my show, NAINAMD, Fusion of Science and Beauty. And today I've got a fabulous guest with me. Her name is Dana Elise. She's one of the expert electrolysis locally and even throughout the nation. So tell me a little bit about why do we really need electrolysis when we've got so much laser treatments going on. We're all under the impression, and I as an anti-aging physician have so many lasers in my office, as you know. You work with me as well.
Sure.
And I do hair removal for so many clients.
Why
but exactly, why the electrolysis?
Well, I've been doing electrolysis and skincare for over 30 years. And with lasers, because I used to do lasers years ago as well, and they're wonderful and appropriate for light skin, dark hair. But anybody who has blonde, red, gray, or very fine hair, there's just not enough melanin for the light source in the laser to be attracted to kill. So people who have blonde hair and have excessive facial hair, or women who go through menopause that I sent you for the anti-aging, they all need, and women who have hair on their face, they want it off today. And with laser, you're getting 35% each time. What are they doing with the other 65%?
And I think the audience sometimes is not really aware, because so many of the laser sort of those treatment centers that advertise, people are under the misperception that it's permanent. And it's not permanent hair reduction. You really get a very fine coat, and that's not hair removal. Whereas electrolysis, I often send my patients, sometimes after the laser treatments, when the hair is still not going away, they'll come for the electrolysis.
Well, it's the only true FDA true permanent hair removal.
Exactly.
Where the other is permanent reduction. And the other area that we're a very big area are people of color. People who are East Asian. Because the laser,
a lot of the laser is not good for all skin types. Exactly.
Or just color their skin.
Exactly.
So we do a lot of African American ingrown. There are men with beards, and they have really troublesome problems. So we work very deeply with dermatologists, plastic surgeons. After men have facelifts, and all of this is brought behind the ear, we have to you have to pretty much redesign the hairline.
Yeah, absolutely. So, and there's no way the laser is going to be able to do that.
No, you can't get it. You want it to look feathered and natural, so you want to do every third hair, so it looks like that's how God made it.
Yeah,
not how a laser liner.
And I've seen you do it. It is very, very time-consuming, beautiful. I mean, you have to really know and to be able to precisely know which hair follicle that you're going to go after.
It's very much like microsurgery. You have to pick every individual hair to sculpt a hairline perfectly. I wanted to just share these with you. This is a hairline and eyebrows that I did. She had very heavy hairline, like little half-inch.
I see that. Here. Look at that. That's, oh my gosh.
And thick eyebrows, and she's so much happier after. So that was just one lovely lady. And then this particular lady, who's just gorgeous, she's a model, she had all these little things hanging down.
My goodness, look at that.
And her eyebrows, and it just, by cleaning everything up, it's just a cleaner, fresher look.
This is really dramatic.
So we do a lot of celebrities, but they won't let me tell you who they are, because they
want to think
that they're perfect as they are.
I get the same thing. The other thing, you're an esthetician as well, and as we know that even the blonde and white hair, there are lasers there that are now currently available that will address that color of hair. However, it's still not as effective, I think, as electrolysis. And that's really what I wanted the audience to know, is that don't get frustrated if you can't get rid of all the hair, because there is another procedure out there. That's electrolysis, and it's been like around for so long, and yet it's kind of gone under the radar, and I don't know why, and I want to bring it out because I think it's very important and part of the anti-aging whole spectrum of how to take care of yourself, because we sometimes, especially on the face, we don't get all of that permanent hair reduction. So we really need that.
And it's very bothersome, like women who go through menopause.
And, and they get those chin hairs,
well,
and that little blonde fuzz as well.
Makeup, and it really shows up. And the other thing is, there's a lot of women who can't have so much heat in their skin.
Yes.
With the lasers, which we discussed because
yes,
of pigmentation and anti-aging and
you have to be very
hormones.
careful because some women already have a lot of sort of, so to speak, a lot of heat. You know, in the Eastern, there's something known as the yin and the yang, and the too much heat and cool and so forth. So yes, I think there is a place for lasers, but there's an amazing place for electrolysis as well. Tell me about the Electrolux facial that you developed.
Sure. Well, you have to be an electrologist and an esthetician. And I found from my earlier years, people would come in with acne, and hair is usually what's the problem. You're having those little hairs that are holding the debris and the environment and creating acne, besides hormones and all the other reasons why you're breaking out.
Yeah, because that hair follicle has surrounds all of it. It can produce inflammation.
Absolutely.
And once you get that hair out, you're free of that. Yeah, absolutely.
So what's wonderful is if they do have a very bad acne lesion, I can go in, because wherever there's a hair, there's a pore. So you go in, you heat it, and then everything comes out like butter. So you're not damaging the skin, you're not bruising the skin. Then we go back in and we sterilize it. So when they come away from the facial, the bumps are gone, the pus and all of the debris is gone, and their skin is beautiful, and they're so thankful that it's not bruised and pigmented, because they already
is there any downside? Is there any side effects of electrolysis? Can you cause hyperpigmentation with electrolysis?
I've not in my 33 years, and if you're a bad anything, you can create bad things. But the skin is the paramount reason. I want you to have beautiful skin and no hair. Otherwise, what's the point? So, we're very gentle. We have 3 different machines. My partner, Karen Wolf, is a master electrologist and esthetician, and I have another, Gladys Valbuena, who's been with me for 18 years, and she's also a veteran of 30-some-odd years.
Yeah. Well, this is the place to be. I mean, I think I highly recommend that if you are going to seek electrolysis, then you definitely need to have somebody who is experienced. There is another extremely important place for electrolysis, and I think people don't often realize just how important it is, and that is in transgenders. Part of the anti-aging movement is the freedom to be able to choose how you want to live your life, how you want to be, and what gender you want to be. And we are getting a lot of good success in terms of the surgery. I do, of course, the hormone balancing and so forth of the transgenders, but at the end of the day, they need the genitalia. I mean, we've got to go through that process. You cannot do laser and then the beards. I mean, you cannot just keep doing lasers. I have so many laser machines, but I need to have somebody like you, because I have to have that electrolysis procedure.
We've been working with transgender friendly practice for over 33 years, so I've watched many people move into their life and have the success of becoming a woman and removing entire beards, and the genitalia has to be completely permanently removed. It can't be partially removed.
Absolutely.
So we work with nurses that do injections for lidocaine for a pain-free experience, and many of my people go to you for hormone balance. And because what's wonderful about how you do it, and I'm so glad that I found you, because you really know what you're talking about, and you gently ease them into what they need so their bodies can produce and make it, and it makes so much sense. Keep
sensitized,
to me,
you keep the receptors sensitized.
So many people were just doing a cookie cutter kind of practice of, here, use this much, and
hormones is
hormones are so valuable and sensitive, and thank you so much for your work. My people are so happy that they found someone who really knows their magic.
Thank you. So tell me a little bit about when you do, is there any procedure that's as far as the facials in addition to the Electrolux? Because I know you do a combined another sort of a facial. Which other facial is that you do?
It's called the vocal facial.
Yes, tell me about that.
We do a lot of singers. Hello, we're in California.
That's what I was so interested in. This you have to hear this. The audience has to hear this. This is amazing.
Sure. Basically, their vocal cords before they're cutting an album.
Right.
Or a CD or whatever they do today, needs to be in perfect shape. So they come in and we do 2 different teas, throat coat and another tea that opens up the sinuses, and then double steam, and then we of course do the entire facial and make their skin glow, but it is lymphatic drainage, special pressure point massage, and totally relaxing and opening them up. And we do a lot of rockers after they've had a little bit too much party night beforehand, and they're like, oh my gosh, I have to.
And then they come on, they get the IV vitamin therapy, and then there's some great combinations.
Exactly. So we fix them up, put them back on the road, and we have people that will go out to their homes. And
that's how seriously, that's how the elite and the people who are on the move and on the go, that's how they do it. You can't keep that kind of a pace without resorting to a few treatments that, you know, and this is what I really want to bring out in my show. I want my audience, I want everybody to be exposed to really knowing what's out there, and things that they've not even heard about. I don't think people have heard about electrolysis. Everyone just thinks, oh, electrolysis is outdated now because it's old school. We've got lasers now, and nobody understands that just how important it is in the Electrolux facial and the vocal facial, right?
Right, and having the IV
and IV combination,
and I send my transgendered and my men to do the big areas. You know, like bikinis, if they're blonde, they have to come to me. But anybody who's my skin coloring, lasers are fabulous. I did laser. I'm pretty much hairless except for, you know, where I'd like it.
Except where you need it.
Where I'd like it, right.
So tell me, you've always been in Beverly Hills now, right? How long?
I've been in Beverly Hills for 33 years.
But you've moved across the hall.
I know. We're right here at 450 North Bedford, and now we're neighbors, which is so nice because I can just
we do treatments together and then things, we do a lot of patients together.
Appreciate that. And another thing I wanted to share for the transgendered community to know, now insurance companies are actually paying for their plastic
isn't that amazing? That's fabulous.
And for the genital electrolysis.
It's about time.
Right, so it's considered a medical situation where it should be paid for if you're going to change your life. And
well, that is so important. You have to get rid of the hair.
Don't be happy, you know?
Yeah. No, this is really good. This is all so good. Thank you so much for coming on my show, and you know, we have so much to catch up on because you're actually showing me now how the electrolysis procedure is being performed. It is so precise. That's a take-home message, that electrolysis is so precise. She has to watch each and every hair follicle.
It's like microsurgery. You're very treating the skin very tenderly, and it's just wonderful.
It's great. Thank you so much for
having me. It's a pleasure.
That's great. This is Dr. Naina, and we'll be right back with my next guest. Hi, this is Dr. Naina. Welcome back to my show, NAINAMD, Fusion of Science and Beauty. I'd like to introduce you my next guest, Dr. Raj of Beverly Hills. He's been everywhere, Fox News, you name it. Tell me a little bit about, really, you're an orthopedic surgeon, very well known, and the reason I really wanted the audience to listen and hear you out is because you're doing things that no one else is doing. So, for example, like on knees, everyone is always complaining about, like, oh my God, my knee hurts. I get so many patients that I stop running, I can't exercise because my knee injury or my knee hurts, and then I say, okay, what does your doctor have you on? Well, he's got me on medication like Advil or Naproxen, you know, some kind of an anti-inflammatory, or they're giving them those Synovisk injections, you know, those kind of injections to help their cartilage a little bit, or they'll undergo surgery. And a lot of times, even after surgery, they're still like limited, or they're saying, I don't get my movement, I can't exercise. And you know me, I'm all about hormones and exercise, diet, lifestyle. I'm limited. So I started actually referring to you as some of my patients, and amazing results. I mean, fabulous results. So give us your secret. What are you doing?
Great.
Anti-aging, we need to know.
100%. Number one, the knee is the most important joint in the body. It's the largest joint in the body as well. The problem with our knees is our whole life revolves around our knees, meaning that if we're trying to lose weight, if we are trying to keep healthy, what do you need to do? You need to ambulate. You need to walk. If you can't walk and you're not active, you're actually out of the game.
Yep.
And once you're out of the game, you'll gain weight, you'll start getting depressed, your metabolic rate will slow down.
Inflammation starts going up, right?
And then you'll start loading those knees. So every extra pound you have is 5 extra pounds for your knee joint. So suddenly you become more and more disabled. So the whole premise of what I do is you look at a knee and how do you not just correct the problem, but how do you turn back time?
Yeah.
And so when I look at a knee, what's different about me is I do joint replacements, I do arthroscopies, and I also do stem cells. So I covered a whole gamut. So you're not going to a surgeon who looks at you and says, I'm going to scope you for the ninth time. You're not looking to a joint replacement guy saying, come back when you're 65 and we'll replace your knee.
So you're doing what anti-aging regenerative medicine is, hey, what can we do to fix a little bit in the inside? What can we start looking at? Maybe we can start having you try to grow your own cartilage or try to put back a few of the cells that you really need.
That's a great one. I mean, it is an amazing concept. Years ago, we couldn't even think about that. Now we've got the opportunity where I'm not taking embryonic cells, I'm not taking amniotic cells.
You're taking
I'm taking your own stem cells.
Isn't that amazing?
So what's better than curing your own body with your own body products? I mean, when we fracture a bone, when we cut our skins, when we rip our tendon, it's our own stem cells that are attracted to the area that repairs it. Suddenly I'm taking your mesenchymal, your own stem cells from your pelvis.
And what's it like mesenchymal for the audience? Is like the blood, right? That's from the blood, the bloodborne tissues.
From the bone marrow,
or
yes.
bone marrow, right.
I'm taking these concentrated stem cells and putting it in a knee joint. It's such an attack, your knee would never see it because the knee doesn't have blood supply. Right. So your knee can't attract that number of stem cells. So when I look at a knee, first of all, I look at someone who's aging, who has changes underneath their kneecap, they're limited. We have to look at how to correct this. How do we take them out of pain and keep them in the game? That's why I utilize yourself too. On the anti-aging aspect, you help me get rid of their weight. You help them, physiologically get rid of their depression, their secondary issues.
And actually reduce their inflammation so that the stem cells then can thrive. Stem cells will thrive in an environment
100%.
when they're like less inflammation, when you've got the proper nutrition, proper hormone, right? That's like optimum. Then they're happy.
100%. Now here's the deal. I mean, if you have a defect, cartilage defect, meaning no cartilage.
Right.
Traditionally, you'd go to a surgeon. He said, "Let me replace it. Let me inject."
Total knee replacement,
It's all BS because you're just putting a Band-Aid on what's already there. I'm looking at how do we reconstruct cartilage. So if I go in, what I'll do is I'll do a microfracture technique, scope it, create blood supply at that lesion, then take the stem cells, place them in, and create pseudo-cartilage after a while. The results have been incredible.
And again, explain to the audience that this is, when they hear the word stem cells, it's like suddenly people get scared. We really need to explain to them the concept of their own stem cells, and then also explain what, how the FDA has this thing that you've got to use the tissue and how you have to process it.
Sure.
Just explain that concept so that they feel safe, that this is a real deal here. I mean, you can absolutely do this and within the FDA guidelines, and it's all okay because so much misunderstanding and misperception is that, oh my gosh, stay away from stem cells, or you're going against what the FDA is ruling, or whatever. And please clarify that for us.
Huge stigma. Humongous stigma throughout the years, because years ago with the prior government administration, we put a ban on stem cells because of the lobbyists, because everyone envisioned embryonic stem cells. Everyone thought this is sacrificing babies, abortions that led to stem cells. Yeah. When you're actually talking about your own stem cells, I mean, I'm taking your own stem cells.
Yeah. It's more natural. That's bioidentical. Bioidentical.
100%.
Yeah.
You can't get any more natural than this. Yeah. We're not putting foreign body. We're putting your own products back.
And you're giving it in the same procedure, within the same few hours, or within the hour, as you get it.
Actually, even better, within the hour, because this is all it takes. It takes 45 minutes.
Is that how long your procedure takes?
45 minutes. Amazing. That's it. Yeah. I need 45 minutes of your time to give you back your life and regenerate me.
Yeah.
I mean,
give me. I know we can't name some of our clients, but I know you've had a lot of celebs. Give me a case, just an example, just so that you can share with the audience.
So I had a top A-list celebrity who was just limping,
a
lot of pain. He was suffering. Every time he'd come on set, he'd need Symvis, cortisone injections. He had more cortisone injections. I know what you feel about cortisone.
You know, okay, so let's discuss cortisone just a minute before you get back. You can, if you continue to have that cortisone, there is a little bit of a systemic absorption, and it can cause a lot of issues. We have seen and taken ultrasounds where it does interfere with bone remodeling, and you know that. And so I think that is so important to say, where like, so that is not just the answer is to give cortisone injections. So anyway, go on. I know I interrupted you, but
I mean, it's
so
a great concept.
Yeah,
it's the best. It's a Band-Aid. Yeah. All I'm doing is giving you a month.
So this guy was like having cortisone injections repeatedly.
Cortisone actually on a local level will actually over time degenerate cartilage.
Yeah.
So you'll cause an adverse effect to it. So he's been repeatedly getting cortisone. So suddenly came to me. He got an MRI.
Yeah.
And young guy, he was in his 50s. I mean, 50s is the new 20s.
Yeah, with the new 20s, it is.
So what I did is I identified a lesion in his knee, just a bone-on-bone area. He had a bowed leg, so he had increased pressure in that area. So we offered him an operation. He sufficed. He was in good shape.
Wow.
He was just suffering. He was on more Vicodin and
see, that's going to mess up the liver, right? So now you take pain meds, which is messing up the liver, causing more inflammation, right? And more accelerating the process to degenerate.
And he was depressed too.
Yeah.
I mean, who wouldn't be depressed if you rely every day? You rely on every step you make. You have to rely on taking Vicodin, and you have to wait for a cortisone injection. I mean, he can't go dancing. He can't go running. He can't just go hiking. Wow. His life relied on that. Now he's in a public eye as well, so he had to walk normally on the red carpets. So I took him in, scoped him, did what's called a microfracture. So if he had a hole, I took a pick and stimulated blood supply in that defect.
Oh, so that's going to get the stem cells coming into that.
2 levels, yeah.
2 levels, yeah.
Blood supply,
and the growth factors, right?
And the growth factors. And then I took his own stem cells from his iliac crest right here. Which
is the bone, so they go. Is it very, it's not painful nowadays, right?
No, it doesn't hurt me at all.
Yeah.
I'm just kidding. No, it's not painful.
It's not painful.
It's done under a lot of local.
Yeah. Yeah.
I think, honestly, like if you have an orthopedic surgeon, this is the second thing is, if you have an orthopedic surgeon doing this procedure, that's the person who should do it. We know how to take bone marrow.
Yeah.
We know, we can identify the problem. Yeah. Going to...
You know, I'm being honest with you, I do autologous stem cells, which I'll give IV, but I don't use... I do it intravenously for rejuvenation and all that, but I'm not doing it for the knees. That's reserved, I think, to orthopedics. You guys know that anatomy the best. You can identify because you can fix 1 or 2 other things, and you know all. You tweak it. You tweak it.
We can actually change the fate.
Yeah.
I mean, if I didn't do that, what would happen is then we'd have a void defect. So it's all about optimizing the effect.
Yeah. And so I keep interrupting you. So tell me what happened to the patient now. So he comes to you. You did the micro fracture technique. Yeah.
And at the same time did the stem cells. So within 45 minutes, his surgery was done. Afterwards, he walked out. Strong anti-inflammatory, you know yourself. That's the best quality, immediate anti-inflammatory. But what was the best part is that anti-inflammatory effect started day 1. Yeah. This is not Marcaine or lidocaine. That lasts for 2 hours or 4 hours. Started day 1 and persisted onwards, and is still there 4 months.
And his life's probably changed, right?
And a year afterwards.
And his life's changed.
We repeated an MRI at 6 months. That defect that was seen is not there.
That's regenerative medicine.
Yes.
That's regenerative medicine. And this is the whole purpose of this show, is to say, you guys, it's the real deal here. Anti-aging and regenerative medicine is here. And we have every means, and we have every viable means to address it.
I mean, what's the point?
Did it change his quality of life? I'm sure, right?
100%. Now we can go out, walk, not rely on cortisone injections. Yeah. What's the point of living to 100 if you're living in pain and suffering every day?
Yeah. And what do you think about people who always say, like, you know, I'm just getting older. It's just natural to keep aging. how do you? I always, I mean, I know how I deal with it. How do you deal with that?
I think it's
how do you
based on
use that concept? Yeah,
it's based on society and it's people giving up.
Because you know the genome.